to request Dr. Upadhyay to get us started on the topic of Ayush. How can Ayush be mainstreamed into the hospitals of tomorrow? How can that really be one of the big contributions of India to the world? Dr. Upadhyay.
How Ayush hospital for tomorrow will be based on the policy we are going to take on today. Tomorrow is decided how we plan for today. So we have a vision to be developed country by 2047. Viksit Bharat. That is the goal for all of us citizens of country by our country. So how to achieve to be developed country? To attain developed countries, we should meet the standard where all other developed countries are meeting as on today. So for that, we have to upgrade ourselves. So Ayurveda, Yoga are the indigenous strengths of our country. We are dwelling on the strength of Ayurveda and Yoga. We want to promote this as a soft power across the world so that this is our strength. We have to showcase our strength to the world. So that is the policy. So our National Health Policy 2017 is aimed at mainstreaming of Ayush in general health services. So how to do mainstreaming? Mainstreaming, there are many ways. We have different models of mainstreaming of Ayush. For example, All India Institute of Ayurveda, where we have state-of-art diagnostic facilities where patients across the country can come over and get their diagnosis on the basis of modern technology, but their treatment will be based on Ayurveda, where both the systems, doctors of both the systems are there in the facility. Patients will get diagnosed by modern doctors and they will choose optimum Ayurveda treatment for their illness. This is IA model. We have one more model at NIMANS. NIMANS model is patient-centered, where patient will be diagnosed by a team of doctors, where there will be psychiatrists, psychologists, Ayurveda experts, yoga experts. All together, a team will consult the patient together at a time, and after talking to patients, they will discuss themselves what is the mutual strength, and then they will give the choice to the informed choice to the patient. See, these are all the strengths of each system, and we want to have psychiatry this option we have, yoga this option. So patient will be given choice, and all the systems together will treat the same patient for the common benefit of the patient. This is Niman's model. Now we have one more model, AIMS model, where the experts of both the systems, conventional system and Ayurveda and Ayush systems, they sit together, they will discuss together, they will decide what protocol to be adopted for the benefit of the patient. So to decide on the protocol, they will conduct a study where taking the strengths of each system, and they will verify, they will examine whether this model will be suitable for the patient, and based on their experience, they will design this is the integrative model which can be adopted for the benefit of patient, which can be adopted across the country. That is the AIMS model. One more model, NHM model. NHM model, where co-location is the key. It is a cafeteria approach. Patient will be given choice whether you want Ayurveda, you want allopathy, you want yoga, you want Siddha, whatever the system of your choice. We will give you facilitation at the same premises so that patient will choose whatever the treatment of his choice as per their experience and their inputs. This is NHM model. So government is not only mainstreaming Ayurveda, now we are focusing on scientific evidence creation. See, these Ayush systems are there from time immemorial. They are having its own strength, everybody recognizes, but there is no sufficient scientific evidence on record. So that is the lacuna where people from other systems are not yet confident that whether this can be advised to all patients, whether these evidences are enough to take these systems further. So further, government is keen that Ayurveda should be promoted on the basis of evidence. So generation of evidence is the key for promotion of Ayush. How to generate evidence? So whatever the Ayush experts as per their system, they will design the protocol. Modern scientists will apply their research methodology, and with common research methodology, whether how the Ayush treatment, Ayush intervention give the output. This is how we will create the evidence. Once the evidence is generated, it will be publicized in the international journal, reputative journal, so that all scientific community can accept it as a evidence which can be taken on record and which can be tried on other patients across the world. That is the concept of evidence generation, then research and development. Actually, as on today, we are only following 2% of what is told in these systems. Not all the science which is told in the classic books are in practice. This is because of generation gap, and those practices are not tested properly as on today. If we, without bias, if we encourage scientists from both the streams to come and discuss mutually, we will have lot of opportunity. In future, now only all the center of excellence you may be seeing in IITs, AIMS, Indian Institute of Science, ILBS, NIMANS, all the apex institutions of the country, they have center of excellence in Ayush. What they will do there? For example, microbiota, there is study related to Ayush Prakriti. Genomics, there is a study related to Ayush Prakriti. And in future, you may be having a situation where genes are classified as per doshas, Vata, Pitta, Kapha doshas. So there is a Vata predominant genes, Pitta predominant genes. These can be identified. Antibiotics, viruses, they can be classified according to doshas. So if you open up these flora, these research problem, there is ample opportunity to support the current conventional system, so that when which antibiotics has to be prescribed to which patient, you can have inputs based on Ayurveda outlook. So these possibilities are possible in future hospitals. You will have all modern hospital now, even in private sector also, so many hospitals have come out with Ayush integrated centers. I hope by next year, all of us will have our own Ayush centers in our hospitals. That's the expectation from all of you. Thank you.